I've worked in healthcare pretty much all my life.
Oh, cool.
Went from working in the corporate world in hospitals and then moved into training by accident, which is what
That's
many
always
people
fun.
do, as opposed to having my sights set on that from the beginning.
Yeah.
It's changed a lot. It's changed an awful lot. We've, I think, moved away. When you think about healthcare, you think about all of the clinical training. That's,
Right.
you know, it's very precise, and it involves equipment and patients and all the rest.
Right.
But if it wasn't that kind of specialty training, and you know, you need to be the subject matter expert, anybody could do it. You know, if you were looking at leadership development, or
Yeah,
you were
exactly.
looking at managing change or that sort of thing, well, anybody could do that.
Right.
So what I've seen over the years, and it's taken a long time too, it's not been a revolution, it's been certainly an evolution,
Right.
is that people are starting to recognize that there is a skill and an expertise involved
training, yeah.
in the whole training and development world. And
Right.
you may have it all up here, but if you can't communicate that knowledge to someone else in
Right.
an effective manner,
That's a good issue.
and you don't know how to set goals and what to look for as outcomes and so on,
Right.
it's a lot of wasted resources. And in
Definitely.
healthcare, they don't have resources to waste.
Right.
So I see it becoming much more recognized as a legitimate profession. Maybe not quite as quickly as some of the other industries, because I think in healthcare the technology is usually involving patients,
Right.
and there's, you know, the leaps and bounds in terms of advancements from the patient care perspective.
Right.
Not so quickly in terms of the learning and development side of things.
Sure. Okay.
But it is moving in that direction, which is nice to see. And I think finally, in the last few years, the learning professionals are now at the table,
Good.
which is not something that has ever happened, you know,
Right.
in the past. It was very difficult to get your voice heard at the table, so to speak. The innovation, again, is more directly related to the innovations around direct patient care,
Right.
and all of the equipment that's involved there. In terms of training, we have the long distance learning and the ability to have face-to-face conversations and to be in a classroom somewhere halfway around the world. And
Right.
we've brought managers and leaders and physicians and all the rest of it into that world too. So that's been something that's evolved too over the years. And so that's been good. And even in the community, I have to say, I work a lot in the community with organizations now, and that's the case too, is because a lot of folks that are maybe their physicians are miles away.
Right.
They can't travel a lot to get to and from. And so they have that opportunity to have the consultation occur,
good.
you know, face to face, one on one, because of technology again. It gets kind of lonely when you work on your own, and I've missed that sense of community.
Yeah.
And so that's one of the things that this organization has provided me for many years, is that sense of community and support and friends and
Oh yeah.
among other things.
Definitely.
For sure.
Contacts and networking.
Yeah. The Institute for Performance and Learning has been kind of my family, basically. I've been coming to these conferences and volunteering and working and just learning for many years, and
Great.
we'll keep doing it as long as we can.
And so will I. Thanks, everyone. Well, thank you so much for your time.
Oh, you're welcome.
Appreciate it.
My pleasure.